Hello and good afternoon. If you are joining us, we are here to talk all about Sculptra today. We are super excited to have Dr. Garcia with us. My name is Akila. You don't need to know anything about me. You know who this lady is here. This is Dr. Garcia, owner of Sculptra Dermatology. Thank you so much for joining us.
Thank you. Thank you for having me.
All right, so we are super excited. This is going to be a really great conversation. If you've heard about Sculptra, if you're thinking about it, if you're kind of debating, is it for me, is it not? And you may have seen on Sculptra's social media that it's actually one of our specials for February.
Yes.
So if you're thinking about it, now is the time to actually jump in. But if folks are kind of curious and they want to know more about Sculptra, tell us kind of an overview. What is it?
So Sculptra is actually one of my favorite products. I've been injecting it for over 15 years. It's not a true filler per se. It's a biostimulator.
Okay.
So what happens as we get older, the hallmark of aging is loss of volume. So patients come in and they say, why do I look saggy? Why do I look like my face is deflating? Well, we start losing volume somewhere in our late 20s, early 30s. So our skin cells stop making collagen.
Okay.
And that's a problem because that leads to the aging process. So the beauty of Sculptra is it's polylactic acid. It stimulates our body to make collagen in a very natural, subtle way.
Okay.
So basically it wakes up those fibroblasts, which are skin cells in our skin, to start making that collagen and almost try to reverse the aging process.
I see. Okay.
So it's I tell patients who are just not ready to maybe take that jump into true fillers, it's a great preventative product because it's just going to restore that volume over time in a slow, subtle way.
Okay. Okay. Fabulous. So I love that. I love that overview and kind of understanding, I think people want to know before they put something in their face, how does it actually work? What is it actually going to do? So tell us a little bit more about, what results do you see when somebody does go ahead and use Sculptra? How long does it take? What do those results end up looking like?
Yes. So depending on the individual patient, I recommend anywhere from 1 to 4 sessions. Average is about 2 to 3 sessions.
Okay.
It's injected in the office. We do some topical numbing. It's injected. You go home. We instruct you on how to massage this product. You massage for 5 days, super easy. So the results start kicking in. Most patients can tell at about the 1 to 2 month mark, but it peaks at 6 to 9 months and lasts 2 to 3 years or even more. There's studies that have been shown that this collagen it's collagen that we make. So we get to keep it once our skin makes it.
Yeah.
So it peaks at 6 to 9 months. That's when you'll see the most results.
Okay.
And last up to years. So it's a great investment. I tell my patients, and they love this, that this is the closest thing we have to the fountain of youth because the problem is we're losing volume and we're stimulating our own body to make that volume back that we've lost over time.
Yeah. So in terms of ideal patient, case scenario, is this something you should be doing? Wait till you're in your 60s. Is this, you could already be doing it in your 30s? Like, where do you kind of start recommending this?
So we start losing collagen in our late 20s, early 30s. So my very proactive, cosmetic savvy patients like to start, even if it's 1 or 2 vials in their late 30s, early 40s. We lose 80% of our collagen by age 60.
Oh my gosh.
So you don't want to wait. Ideally, you don't want to wait till you're there. You want to start restoring that volume in a natural, subtle way, and you'll just have better results. Everybody degrades collagen in a different way. Genetic factors have to do with it. Lifestyle. Smokers, patients who smoke tend to show it more in their face.
Yeah, absolutely.
So, if you're out in the sun all the time, that affects skin cells that can promote actinic damage or sun damage. So there's a lot of factors, but ideally this is to restore that volume and also prevent that volume loss.
Right. Okay. All right. So, you're making it sound like this is, like you said, the closest we have to the fountain of youth. I think a lot of times when I hear of something that sounds this great, I think, well, I'm going to definitely have downtime. I'm going to have I got to be, no public appearances for a whole week and be out of sight, out of mind. But what is the downtime like for Sculptra?
Honestly, it's very minimal. So we will do the injections in office. I tell patients expect some swelling, some bruising for the first week or so. Most of the swelling resolves after day 3 to 5. I have a lot of patients who do this and then just have do it on a Friday and they're back to work on Monday. I have patients who come in their lunch break and Go
Wow.
back to work. So everybody's a little different in terms of how they react. But I've been doing Sculptra for many years, and I have patients who actually time it before events
Oh my
because they
gosh.
like that full feeling.
Right. If you had a wedding or something, like
I don't-
really,
Yeah, I don't recommend that, but I do have my cosmetic savvy patients that have been with me for over 10 years. They're like, Dr. Garcia,
Yeah.
it's wedding time. I need my Sculptra. So
Yeah.
ideally, though, you do, especially if you're planning ahead, remember the peak time for this product is 6 to 9 months.
6 to 9 months.
And I tell
Okay.
patients, look at your driver's license, and if it's 5 to 10 years old, you're like, how will I look? It's just looking how you did a few years back.
Oh, I would
Before
love
you
to get
lost
that
that
driver's
volume.
license photo back. Yeah, absolutely. Okay, so you talk to patients all day, every day. You are telling them whether or not this is a good fit. Do they ever come to you and have any misconceptions about Sculptra, or you have to kind of walk them through and educate them on, no, don't worry, it's not,
Yes.
XYZ kind of thing?
Absolutely. I have patients who come in. How many of us have done this in the mirror? So there's definitely a place for surgery in the
Mhm.
aging process. This isn't a surgical facelift.
Right. Okay.
Even though we do call it a mini liquid facelift sometimes, because you
Mhm.
can have some of those results if you address the aging process at a good time, again,
Right.
earlier 40s, 50s.
Yeah.
But there is some common misconceptions. It is going to be a slow process
Mhm.
for those patients that want to look fuller and better in a week to 2 weeks time. This is not the product
Not
for
it.
you.
Yeah.
But I tell patients that this is an investment in you over time.
Mhm.
So
Mhm.
you have to think about this as an investment over time
Mhm.
to reverse that aging process and just age gracefully and
Mhm.
age more
Mhm.
youthfully. No, I'm big on natural,
Absolutely.
subtle results,
Absolutely.
and I
Yeah.
think this resonates very well with a lot of my patients.
Yeah. 100%. 100%. Now, if I choose, okay, yes, I want to dive in, I want to try Sculptra. Can I still do some of my other things like my Lace MD, my Halo? Like, am I still able to kind
Absolutely.
of choose the full suite of services?
Yes, and so most of our cosmetic procedures do play on that stimulation of collagen.
Mhm.
So ideally, you want to do it in different ways and use different modalities to
Mhm.
obtain optimal results.
Sure.
So we recommend the lasers for more texture tone, pores, brown pigmentation, microneedling for a little bit of tightening. But you are trying to stimulate that collagen,
Right.
but in Sculptra stimulates that collagen optimally.
Mhm.
And it's probably the best thing we have for that.
Okay, fabulous. So let's talk a little bit about our special here. It does not go on special. I think, we've, been seeing specials come every single month, and Sculptra does not come around very often. So.
Yes, it's a specialty product.
Yeah.
Not a lot of people are trained to inject it.
Mm-hmm.
Initially, only back when the company first started, it was very selective on who could inject it.
Mm-hmm.
So it is something that's more of a specialty, and it's a pricier product. That's because it lasts longer than our other.
Right. Yeah. I think if you, backed it up and you looked at the cost of filler versus the cost of going ahead and doing Sculptra, if it's lasting, years, it really makes a lot of sense. So, all right. So what we have right now for the February special, we're going to read through just so we make sure. I know you guys are going to be, writing down everything we say, I'm sure. February 28th is going to be the end of this potential special to take advantage of. And by the way, if you guys are watching right now and you are commenting, leave us some questions. Let us know what have we not answered yet that you want to know about. So by all means, leave those comments in the chat. And even if you're just watching and you want to check in and say hello, any of those comments to let us know that you are watching are going to be entered into a giveaway, which we'll share our special product basket here in a second. But that February special is going to be good through February 28th, or you can book it right now if you want. There's a QR code right above us if you want to go ahead and scan and get set up with your consultation right now to see if it's right for you. But you're going to be getting exclusive special pricing on Sculptra. You are going to receive complimentary Dysport. Am I saying that right? Dysport?
Yes.
Okay. All right.
Yes.
And you're going to have even smoother, refreshed results. So tell us, okay, let's back up real quick before we'll leave them hanging a little bit longer on the special.
Okay.
When you combine Sculptra and Dysport, tell us about kind of that 1-2 punch.
So Dysport relaxes muscles. So for those 11s, those stubborn, 11s that patients say, this I get these lines in between my eyebrows and it makes me look angry.
Yeah.
Crow's feet, forehead
I
lines.
get the bangs, so I don't have to worry about,
Yes. So it's going to relax those deeper wrinkles.
Okay.
So everything in combination ideally works best.
Mhm.
Sculptra does help with texture as well.
Mhm.
I have done it for acne scars with very good results.
Wow.
So it
Okay.
helps with texture and tone of the skin too.
Okay, fabulous. All right. So you will receive that complimentary Dysport as well. Then we will have that special pricing if you make your deposit by February 28th. So 2 vials of Sculptra are going to be $16.50. So that's $825 a vial. And that means you're saving $150 plus you get up to 36 units of Dysport. Okay. If you want to bump it up a little bit, and we talked about, you're looking at, depending on your situation, you may need a little bit more, a little bit less in terms of vials.
So a
Go
good rule of thumb for that is we recommend a vial a decade, kind of. So if
Okay.
you're in your 40s, you'll probably need about 4 vials for optimal results.
Okay.
Doesn't mean we have to do the 4 vials, but
Right.
that's kind of a good rule of thumb for patients that say, oh, I'm 45, I'm 55, I'm 65. How many vials?
Okay, got it. Awesome.
Will
That's
I
really
need?
easy to remember. So for 4 vials, which we just talked about, might be ideal for you, it's going to be $32.50, so $3,250. That comes out to $812.50 a vial, and that's going to help you save $350. So with that, you're going to be bumping up as well on your Dysport. You will get up to 72 units of Dysport as well. All right. And then if you really want to go big or go home, if you're just ready to jump in and you've, used Sculptra in the past, you know it, you love it, or you've heard all about it and you're finally ready to take that leap, you can do 6 vials for $4,800, which is going to be $800 a vial, which is a crazy good deal. And it saves you $600. And that way you're also going to receive 108 units of Dysport. So you've got those 3 tiers. You can choose between 2, 4, and 6. And don't feel like you have to make that decision right now, right? You can absolutely come in and have that consultation and understand exactly what would be the best route for you. All right. Now, on that deal, you have to be booking it before February 28th, but the actual treatment, the first treatment has to be done before June 30th of 2025. So if you've got a, event you're trying to time it out for, if you're thinking about, okay, 5 years from now, I want to be married, we can't quite hold on to it that long. You have to be doing your first treatment before June 30th. But if you're aware of that, if you're good to go, you can absolutely scan that QR code and book a consultation, find out more about it, or give us a call. What else? What questions do you think? Yeah, go ahead.
This is something Sculptra, a lot of our faithful patients, loyal followers have been asking for a Sculptra special. I know who you are out there. We do our 12 days of Christmas in December, and everybody was anxiously waiting. And I promised these patients that we would do something for them. So this is your chance to jump on this awesome special.
Yeah, absolutely. Especially the week of Valentine's Day. Like, this is your gift to yourself for Valentine's Day. You should absolutely go ahead and take advantage. All right. So we have a couple questions here. We're going to bring up one. We have one from Catherine. She is asking, where on the face is it typically injected? That's actually a great question. Go ahead.
Yeah. So Sculptra, the beauty of Sculptra is it can be injected almost anywhere in the face. That includes temples. So as we get older, we start losing volume in our temples, and our eyes become more deeper set. I have patients that say, feel like my eyes are sunken into my skull. Well, that has to do with all the volume loss, the displacement of fat pads around the eyes. So we inject it in temples to restore that volume. We can inject it in the cheek, anywhere in the cheek area, jawline, chin, nasolabial folds. It cannot be injected in the forehead, neck, or lips. So those are the 3.
Okay.
We have other products for that, but pretty much temples, cheeks, jawline, nasolabial folds around the mouth.
Right. So really hitting, the vast majority of the most areas that women have concerns. Correct. For sure. Okay, very cool. We have a couple other questions I want to touch on before we get into our giveaway. So really quickly, let's show you the basket, and then we'll jump into a little bit more Q&A, and then we can absolutely let you guys get on with your lunch break or whatever you're up to today. So this is our product basket. We are super excited to give this away. It is a full suite of products from Epionce. So we have the Epionce Medical Barrier Cream, the Lytic Gel Cleanser, the Luminous Eye Serum, the Lytic TX, the PCA Hyaluronic Acid Lip Booster. So overall, your total value there is about $300. So be sure to comment. If you are watching and you're just stalking at the moment, get in there, comment, because that's how you're going to be able to enter to win this product basket. All right, so let's jump in a little bit to a few more Q&A. So we've had a couple people asking, we've been teasing this live for a couple weeks now, and we had a few people ask some questions even before we went live today. Number one, we had a couple people, and you've touched on this a little bit, but what is it that makes it different from traditional filler? Talk me through that.
So traditional filler is mostly, the most common traditional fillers are hyaluronic acid, which is also something we have in our skin that we lose with the aging process and with time. So hyaluronic acid is injected directly, usually into the wrinkles, or can it be injected into the cheeks for a little subtle lift. But that you're going to see right away, where this is more of a biostimulator. It's going to stimulate your own body to make that volume, to make that collagen that you've lost. So it's not actually immediately replacing that volume, like it's not filling that. It's more of a biostimulator.
Okay, that makes sense. All right, really good question here. Is it painful? I think wimps like me want to know, like, okay, tell me what I'm in for.
Most patients do great, you know, and everybody has a different pain threshold. Most patients end up saying, this wasn't that bad. We do topical numbing in the office for about 30 minutes. Then we use a cannula, which is a blunt tip. It looks like a needle, but it's not a needle, to inject it. The actual product is mixed with lidocaine. So the first pokes might be a little more uncomfortable, but as the procedure goes on, it's very well tolerated. Takes about under 10 minutes.
That's so quick. Yeah.
And I'll say this. We've never had a patient say, okay, stop, I can't do this. So,
absolutely.
knock on wood, hopefully. That
and you can have your handy buzzy with you, right?
Yes, we have little distraction mechanisms. I have patients, we do offer Pronox, which is the laughing gas, nitrous oxide. Most of my patients don't need that for this particular procedure, but that is an option for patients that maybe are anxious about it.
Yeah, I think you can handle just about anything for 10 minutes. If you told me I got to tolerate it for like 2
and it's
hours.
Usually a little less.
Yeah, absolutely. You can handle that, especially for how long the benefits are going to last.
Correct.
10 minutes is a short time to enjoy 2 to 3 years of looking fabulous.
Yes.
Okay, wonderful. Another good question here. Can you treat areas other than the face with Sculptra? Anywhere else on the body that you could do
So
Sculptra?
you can do Sculptra in other parts of the body. You can do it for a buttocks augmentation.
Really? I did not know that.
Yes.
Wow.
It just, you need a lot more volume. So the 6 vials become 10 vials.
Wow.
15 vials. So
yeah. All right. So kind of, if that's a priority for you, for sure. Okay. So do we have any other questions? Go ahead, Mariah. Anything else?
Linda has had an allergic reaction with filler. Would she be able to get Sculptra instead?
Yes. I mean, most patients, unless you have a true allergy to polylactic acid, it is mixed with lidocaine. So that's an important factor to consider. But most patients do quite well with it. It's extremely rare to be allergic to polylactic acid.
Okay. Good to know. Good question, Linda. Any other questions?
How many vials do you do at a time if you purchase 4?
That's a great question. So each session, usually I do 2 vials per session. So a session is 2 vials. It's very rare. I can do 1 vial at a time. It's I rarely do that just because you're already going through the procedure, you're getting numb, you're coming in. So it's usually 2 and patients do pretty good. But in certain instances, I do 1 at a time, but each session is 2 vials.
And if I do 2, do I need to wait a month? Do I need to wait 3 months? When do I?
So usually, like if you're doing 2 to 3 sessions, we recommend doing them about 6 to 8 weeks apart.
Okay. All right. Fantastic. So you could be looking fabulous by Christmas for sure.
Yes.
You could be ready to go.
Yes.
All right. So one more question we have. Go ahead, Mariah.
Can you explain what Dysport is again?
So Dysport patients, Dysport is the equivalent. It's a different brand. I think Botox is, patients know what Botox is a little more, but it's a neurotoxin. It's a different brand of neurotoxin. And it works great for wrinkles, works very similar to the other neurotoxins. And yeah, that's Dysport.
Fabulous. So I love the combination of Sculptra plus Dysport. That seems like it's just like the best of
the
both
beauty
worlds.
of Dysport is results you get full effect in about 7 to 10 days. So
Okay.
you don't have to wait.
Yes, there you
As
go. So
long.
you're waiting on that Sculptra to kick in, but you've got that Dysport giving you that instant gratification right
Yes.
away. I love it. Okay, fantastic. Anything else, Mariah? We're good. Okay, wonderful. You guys have been awesome. You asked really great questions. You have like the savviest patients ever. So they ask really great questions. But one more time for you guys that are watching, we would love to send you home with this product basket. So if you are a fan of the Epion's products, or if you've been waiting, do you have a favorite in here or any of these like?
Yes, the Lytic Gel Cleanser is one of my favorites. Oh, this is a popular one. This best chapstick ever.
Ooh,
Yes,
yeah,
so
absolutely.
I love Epion's.
Especially
It's a
right
great
now while
line.
our weather's been so crazy, you
Yes.
need some, for sure, lip product for sure. All right, guys. So be sure to comment if you are watching to be entered to win your product basket. You can also watch this live stream back on Instagram, Facebook, YouTube if you want to, catch Dr. Garcia's answers once more and really make sure this is the right thing for you. By all means, go ahead and do that. And we have been so glad to join you guys. Thank you so much for tuning in today to learn more about Sculptra. And we hope to see you in the office very soon. All right. Any closing remarks? Any thoughts? Or
no, I'm excited I got to do this. This is one of my favorite products. I've been injecting it. I have patients that have been doing it for years and come back every 2-3 years for their touch-up session.
Yep.
And I'm just grateful for all my wonderful, loyal patients. Thank you for choosing us to be your medical and cosmetic dermatologist. And
absolutely. Absolutely. All right, guys. So that special for Sculptra is going to be lasting through February 28th. So be sure to go ahead and commit to that now. Then you can book your first session anytime between now and June 30th. And we know you guys are going to love those results. You will never want to go back to anything besides Sculptra once you've tried it. I'm convinced. I'm sure all of y'all at home are equally impressed by all of its benefits. So we will let you guys go. Thank you so much for your time today, and we'll see you soon. Bye.
bye.